I am talking to our oncologists about a relatively common problem we all have in our practice, and that is when we have patients who see us from all over the city or all over the state, all over the country, how do we communicate to these patients and monitor them? How we've always managed this is by patients coming to our clinic, we have a face-to-face encounter with them, and then we make our decisions about therapies, about diagnostics, about diagnosis. And now with all these new technologies that have come along, we now have some new tools in our toolbox that we can use. And that is using web-based technology where we can not only monitor patients remotely, but also diagnosis. What is happening in parallel to these new technologies is that governmental agencies and the government is now recognizing the importance of being able to communicate through telehealth, through web-based technology, patients who cannot get to our offices. Think about the patient who lives very far away and they have to get into the city to see our doctors. How do we communicate with those individuals? We now have this web-based technology. Web-based technology is the ability to monitor and track patients with different diagnoses, in particular for cardiovascular disease. We now can use non-invasive methods of FDA technology that we can implant within the patient's body. And we can monitor them anywhere they are around the world and anywhere the provider is around the world. That information comes through them through cellular technology, so as long as there's a cell tower around them, then they can transmit information either to our computer or our smartphone anywhere in the world.